Hi, this is Dr. Brian Bourgeois of Offshore Medical Logistics in West Jefferson Industrial Medicine. This instructional video is being provided to walk you through the process of an at-home self-collection COVID-19 testing. The video will give you the salient points of collection, including documentation and mailing. So let's get started. Brian is our subject here. You're going to receive in your test kit a specimen bag. Within that specimen bag, there's two important parts of equipment. One is the collection kit itself. It is sealed. You're going to receive two of them in case you make a mistake. Simple as that. Second thing is documentation paperwork, and this is going to go to the lab. This documentation is going to identify the person who the specimen is coming from. It has our return address on here. You don't need to do anything with that. And the other thing it's going to have is we're going to have a label that we're going to affix to this. So let's get started. First thing you should do is open the paperwork. This section right here should be filled in with your name, your date of birth, and you're welcome to put an address. The name and the date of birth are the two mandatory items. You may or may not put male or female. That's your choice. Over here, you don't need to put anything in this section. It's already pre-printed. We're going to save this open space to affix a label. Once that's done, we're going to then address the test kit. The test kit has two items in it. It has a swab and a collection container. The swab, if you notice, is longer than the container. It has a red mark, is going to be the break point, and we'll show that during the collection specimen. Next part is what you should do with this initially. When you first open this, peel it open partly. Leave the swab in place. We don't want to contaminate the tip. You can open a little further, and you can simply take the vial out. Keep the swab in the container. Once again, to keep it clean, you can loosen the top and just tighten it on gently, so for ease of access. And put that on the side. Positioning. You should position yourself with your head at about a 90-degree angle, maybe with a slight tilt. The access to the nasopharynx is about equidistant to about the eye area. It runs at about a 10 or 15-degree angle to horizontal, and that is the manner in which we're going to insert the swab. So what we're going to do is I'm going to take the swab out, and we're going to hold it by the back end. There's your red mark. It's also scored so that you'll be able to break it in the collection container. You don't want to touch anything forward of that. If you inadvertently touch the tip to anything, you have another kit. Discard this and let's use the other one. So what we're going to do is we're going to simply take it like this, and I set it about a 10 or 15-degree angle. We're going to insert it into the nostril, and we're going to advance it back until you feel resistance. Make a slight turn and pull it out. It's one side. You're going to take the same swab, insert it into the nasopharynx again, and pull it out. You may note that one side is easier than the other, and that's simply an anatomical difference between each side. It's nothing to worry about. Even if you have a little small amount of pink or blood on the tip, it's not going to hurt you. It's completely expected. Take that swab, open your container, insert the swab in first. Your red line lines up. You break it off, discard that, tighten it down. Simple as that. You've done your collection. You're going to notice there's some lines on here. Once again, the important parts: name, date of birth. Nothing else needs to be filled out. You can fill out the date of collection if you wish, but it's not mandatory. The last portion that you're provided with is a label. There are two bar-coded labels on here. One label is going to go on the collection vial. The second label is going to go on the paper like so. I would just get you to check both numbers match. It's always a good option. Collection is now done. You can take the vial, the paperwork, put it back in the specimen container. It's just like a regular Ziploc bag. You're going to seal it up, and you're done. Last portion. You're going to take this bag, put it into the envelope or your styrofoam collection container with the cold pack, seal it up. It's going to be picked up by FedEx. You're going to have a pre-printed FedEx label. This will be affixed to either container that you have. Now remember, you have to either call FedEx to schedule a pickup or you have to bring it to a FedEx location. And it is somewhat time sensitive. It should be done the same day as collection. The cold pack will typically last 24 hours. If you have any questions, please feel free to contact us at the number provided. Furthermore, if after watching this instructional video you have any other questions, please feel free to contact us and one of our providers will walk you through it. Thank you.